All right, so getting ready to put this on the on the email to everybody. You already have the email link, but it will make it go to our video for today. So hang out with me for just a minute. So glad to have you here. Leave some comments of where you're calling or where you're from. So let me go ahead and start recording. So welcome, welcome, welcome. I am going to get Dr. Tom on in just a little bit. First, I want to put this on our portal so that you can get this right now. So this should be live. Just bear with me just another second. All right. It's so funny. I was in the backyard in a meditative state and I thought I had all this time. And then Jen came out and said, it's time, it's time. So, okay, so we are on there. Let me go ahead and grab Tom. This feels like a big one. All right. Allow to talk. Move to panelist. Start video, unmute.
Mute now. Yes, okay.
All right, we're good. Hey, Tom.
How are you?
Really, really good. How's it going?
Today's the first day that Connecticut opened up phase 1.
Oh, great. It looks like you got a haircut.
Yes.
I did too. Must mean things are getting back to somewhat normal.
Yeah, there's a little challenge here, but yes, I did get a haircut. So
awesome. Awesome. I'm so glad to have you on. I was thinking today, you know, of course it's whatever you want to talk about, however you feel, whatever you see coming into the field or the you know, what would be useful for people to know about or to stuff, you know, to play with today.
yeah.
One thing I was drawn to was the idea of a miracle or a process. You know, people talk about there's so many miracles that you and I have both seen, and I remember you were talking about the LED story, and I didn't realize how fast the transformation had happened with her when she went from being in a wheelchair to being able to walk around. And so maybe we could review that just a little bit, but I didn't realize, I thought it was even more of a process. And then when I was thinking about myself, when I first got involved with integrated manual therapy, I'd taken a class or two, but somehow I had gotten to the point, I don't remember the exact timeline of it, but I was at a point where I couldn't run for 8 months and had a calf spasm that was just weird. I'd go run, and 5 minutes into a run, I would have to stop. And I was used to running 70 miles or more a week. And it was going on despite orthotics and all sorts of stuff and lots of treatments from my therapist and other people. And at the time I was taking some integrated manual therapy classes and some from Upledger's group with the visceral manipulation and traveling back and forth with all that kind of stuff. And then I went to see Julie in LA, and she put one hand on my foot and said, "Oh, you have a problem with your arteries." And so from what I remember, she did the diaphragms, this technique to open up all the diaphragms in my body, and then the big veins going into the heart and the arteries coming out of the heart, the strain, counter strain from our red book. And I felt way different. And 2 days later, I was in a class, Cranial 1 in Sacramento, and I took my running stuff because I felt pretty good. And I went for a 30-minute run, and it was totally good from there on out. So it was an instant miracle for me. But then I was also thinking, you know, I kept taking a lot of classes and getting a lot of treatment. And over the months and years, my teeth no longer had cavities, which I used to have cavities for the first 37 years of my life, and they haven't now. Knock on integrated manual therapy wood, you know. But and also my anxiety and the sweaty hand thing went away. And so it was a process. And then I was thinking, well, you know, I had a client this week that said, how much do I have to keep doing this homework? You know, I have her doing some wisdom healing qigong and a bunch of other stuff that we use. A lot of the stuff we use in our group sessions, the miracle sessions that do every month, and of course one-on-one sessions. and she was saying, how often do I have to keep doing this? And I was thinking, well, I keep doing my stuff every day, and it's kind of like brushing your teeth. You keep brushing your teeth, but it's not quite, because it's not just maintenance to keep at the same level. It's there's a growth. You're just keeping on getting a better and better version of yourself, is what I find. So I wanted to talk today and hear stories from you of the idea of like how do you access a miracle, and what about the ones that don't seem to be a miracle, and process, and you know, a lot of work going into helping somebody get over what they're dealing with, or but also sometimes you can see it so fast, and talk about Allie D just a bit again, if anybody missed that one, because I didn't realize how fast she had
Yeah.
changed.
Okay. So, what's considered a miracle is in somebody's belief system to begin with, right? So, some things take 5 minutes, and sometimes it takes years to develop. I just saw a new client. She drove up from New York City on last Tuesday or something like that, and she's been gaining weight and has had this 2.5 year journey. And she just discovered even the form of body work, just a little bit of acupuncture, a little bit of chiropractic care. She tried to go the traditional route, and they gave her a hormone disease called PCOS, which means polycystic ovary disease. And we learn about that in IMT, and it's a transformation of life that you have to do. And Western medicine says, oh, we saw these on the ultrasound, so therefore you have this disease. But they never ask what you do about it. They just give you a pill to just try to keep it quiet. And as you know, Ralph, and I know that it's related to if you've eaten too much sugar and had other things going on, it's the tip of the iceberg. And Western medicine either tries to cut it out or drug you up so you don't feel it anymore. And she goes, I've been on this journey. How long is it going to take with you? How long is it going to take with you?
How long does it take with you?
Yeah. And I'm in a hurry now. And it's just like, well, and we went through her history and everything. And she said, well, that chiropractor said that acupuncture said that. And I said, well, at least you know that everybody that's doing holistic medicine are on the same flavor for you. And when you're going to take time to listen that the drugs aren't going to help you and you need to come over here. And I'm sorry you didn't meet me before, but today is the first day of your healing. And it took maybe 20 years to get there or so. So you have some people's impatience, and some of it, is this miraculous 1, 2, 3, and everything changes, right? So going back to Allie D, she had a 3-year journey of just trying to find us. And she was in the San Francisco area. She was 14, and she dove into a swimming pool, and she dove into the shallow end. So she came up with a little neck compression and a concussion, and never thought anything about it. But over the next month or so, she started to get paralyzed. She was a paraplegic, not feeling from her belly button down, and not able to walk, and they couldn't find anything. So in that 3-year journey, she was actually put into a mental institution and institutionalized for 6 months because they thought it was all in her head.
Wow.
She went to somebody that had trained with us for 1 or 2 visits and started feeling something. So her sister was a massage therapist, looked us up, and then flew out here. And we did our due diligence. We do our mapping, and on these body maps, Ralph, they're just amazing because they tell the whole story of the person's life sometimes. And one of the things I like to tell people and my students is, all these healing arts, acupuncture, massage, craniosacral, or osteopathic or chiropractic, they all have their themes of what works. The osteopaths have a saying that they say, we believe that if the body can't control the blood supply, then it has a problem. And the next piece is if you have 1,000, you get 1,000 extra bonus points. So if you bang your arm up, you forget about it hurting you, but if you actually rub the spot, it would be painful. So we use the energy from our subconscious to control that. So that energy doesn't have time to do something else healing-wise. So that's why I call it 1,000 extra bonus points. So when you add all those up, then the body can't control it anymore, and then you have disease. It's like having a car that you bang the curb with, now the alignment's a little bit off, you're going to have tires wearing out faster than somebody that never hit the curb before. And people don't understand those subtleties. And that's what makes us a little bit special, is we go and ask what the subtleties are and start correcting backwards from there. Right.
And with Allie, from being in a wheelchair to walking, was that in the very first time you guys met her, or was that
within the first 2 days? Yeah.
first 2 days?
You know, like
She had like
maybe,
a series of treatments, like hours of treatment for a couple of days lined up or something?
yeah. Well, in my center, and you've experienced this too, we have things called intensives. And I've, you know, I haven't done a formal paper with statistics and research, but we've done it before that, you know, in the mode of trying to help people get better. One of the clinics we used to work in did take insurance because we had physical therapists that were willing to fill out the paperwork. So we had a insurance model that meant that you could only receive a half hour. And, you know, which meant that, you know, we should get paid a certain amount of money to survive for our services. And so in the insurance model, when you have an in-network insurance company, and you have a doctor or a therapist that's in that model, they've arranged to say, I will take what you tell me for the price of that service. So let's say you can get $25 for doing an exercise program, $25 to get a stretching program in, and so forth. And you sign the contract, and you know what you're going to get paid every time you submit to the insurance company you did that service. So what happened was that, you know, we figured out how much do we need to run the office, how much do we need to pay the employees and stuff. And so we were doing half-hour appointments, because anything more, the insurance company says, no, physical therapy doesn't take more than a half hour. We're not going to pay more than a half hour. Wow. So we have patients that are local that want to come in 3 times a week, you know, for 12 weeks. And that's the usual model that most physical therapists and chiropractic offices work for, because they're trying to make the money. And, you know, in those offices, and you've been in these clinics before, that physical therapist may see you, and you may be there for a whole hour, but he's got 5 other patients going at the same time. So yeah, you see the bill is $100, but multiply that by 5. And, you know, in our IMT practices, you get a one-on-one therapist for a full half hour, and we don't try to juggle like 12 people and things like that. So, so what we found was, if you took the time that person needed to come in and receive the body work and leave again, and they were at a half-hour appointment, it would take 3 times longer to get the same service that somebody would do spending the hour. You know, if that person came for 10 visits, so that's 10 hours worth of work at an hour, it would take 15 hours or 20 hours to get the same amount of body work done. And then we started seeing multiple hours. So some clients come in and they can come in for 4 to 6 to 8 hours in a day. And that equals a lot more time. And when I was working with Dr. Upledger, he had a clinic down there that took in 4 patients, and 8 hours a day they just received therapies. So if you had 40 hours in that amount of time for 2 weeks, you have 80 hours. That's like 3 to 5 years of therapy.
Yeah.
Over the. So
I just got to interrupt a little bit, because most therapies can't do that. Like if you go to somebody that's going to stretch you, if you got stretched for that much time all in one time, that wouldn't be good. But because you're working with the way the body wants to unravel this, you don't have to wait for the body to get over a stretching treatment or something like that.
And I really believe a lot of that was forced because the way that we were trying to itemize our billing procedure codes, right? Because insurance would only pay at 15 minutes for stretching once a day. They wouldn't pay for 2 sessions of stretching or 3 sessions of stretching. So I think the socialism of our insurance medically driven paperwork really got that down for a while.
So with Allie, she came in for a couple of days and saw you guys for a few hours.
Yeah, well, you know, she flew in, she was in a wheelchair. She had been in that for 2 to 3 years. So the evaluation took 2 hours to 3 hours to get through. And then we set out our plan of the body told us the story of where to start the treatment. And within the 4th hour, we did the strain, counter strain. We did, like you said, the diaphragms, and then we did another one, and we finally got down to the blood supply to the spine. And so you can't just open the blood supply to the spine if you don't open up the heart first.
Mhm.
So we went from heart to the aorta, then to the spinal arteries, and opened that up. And in that sequence of a half hour, she felt tingling in her legs and stood up at that point.
That is awesome. That is awesome. Yeah, that is.
So miracles come in many features. So over the last month, I've seen this person for 3 hours minus, and then an hour evaluation, and she's a professional singer. And she had gotten a cold and coughed, and she had been seeing a speech therapist, and she goes, my vocal cords are paralyzed, and I make my career out of professionally singing, and I do concerts and everything, so I need to do a 45-minute set. And so she knew, with the healing that she received just with the voice coach, and because of the virus, she couldn't go to her, so she was looking for somebody to work with her. So she heard about us and she came in. So she could sing 4 songs, and then her voice would be shot for 2 days. And today I saw her, and we've done 3 hours of work, 3 different visits, and she's up to 9 songs, which is about a 20 set. And she feels it getting stronger and peeling those layers off. So
That's really so cool. And kind of the thing, like, you wouldn't, a lot of people might think, wait a minute, physical therapist, chiropractic, but working on vocal cords, it's like it seems out of the realm of possibilities for doing something with your hands or energetically to change something,
yeah, I think our misconceptions are very weird, because the truth about, if you go and look at the startup of even chiropractic care by a man named D.D. Palmer, and osteopathic medicine by Andrew Still. The Andrew Still was a medical doctor in the 1800s, and D.D. Palmer was a herbalist and magnetic therapist. And the stories go, but from both of them, that D.D. Palmer walked over to somebody that was completely deaf, not being able to hear anything, and he cracked the neck, and they started to hear again. And Andrew Still was somebody that had Crohn's and irritable bowel, and he adjusted the back, and their irritable bowel went away. So we never were these like, oh, I got back pain, I should adjust the spine. Both of those philosophies came out of, you bring the nervous system or the blood supply back, and the body can heal itself, and they were full potential pieces. And me being from Connecticut, and I feel that Connecticut's just 2 hours from Boston, and medicine in New England is pretty snooty. We think we're the best in the world. We got Harvard, we got Columbia, we got the Rockefeller pieces here. And so no medicine is better than our Western medicine. And I went to school in Boston for physical therapy, and I got trained that we were the premium arts and sciences of the world. And when I went to move to Chicago to go to the National Chiropractic School, which was the 3rd chiropractic school open in the country, I was amazed that past the Mississippi, people had a whole different view of holistic medicine. They had their chiropractor, and they had their, most of the farmers went to the chiropractor, the osteopath, to get their muscle sorenesses away. And then when they had something big, they would go to the medical doctor. So they had this co-sharing of life, and going in for 1 or 2 adjustments a month kept them healthy so they can work their farm, and they never got sick, and they would just see the doctor at the end, or maybe for their physical. And physicals weren't really that big thing that used to do back then also. So there was a huge process, and this virus piece is pretty scary. But if we look at these 100-year cycles, I think what we're doing with medicine and turning back to alternative is really wonderful. But in 1920, between 1915 and 1920, the Medical Association and the Rockefellers and Harvard and Johns Hopkins basically bullied everybody into believing that system was the best, and they erased all the other holistic healthcares off the face of the earth, basically.
Yeah,
So
there was a certain law or something or that was put in place, I think.
that there was a high school teacher, science teacher, that was hired to say, what is medicine really about? And he went through all the medical schools on the East Coast. There were about 200 of them, and he wrote a report, and he said, well, they go into category A, B, and C, and A is the model that we have today, and B were schools that were sort of teaching the A model, and the C's were so weird they just weren't even in the picture. The 200 schools, only 2 schools were in the A category, and that was Johns Hopkins and Harvard, and everybody else. And they wanted to do this version, German concept of disease and reverse, the allopathic model. And so this this high school teacher, Fleckner, gave a report that was sponsored by the Carnegies and the Rockefellers, who own the pharmacy companies. And by 1920, the government regulated that either you teach the A model or you're done. And so by 1940, there were only 45 schools left in the country.
Wow.
And they wiped out things. So like New York Medical College used to be called New York Homeopathic School, and they changed the name to improve that whole process.
Wow. So what do you see as like, where's the healing arts going now? Because there are so many people that are looking for all these other routes. And like Jen has a funny story of a book that she's reading, and it's about a woman that's in Turkey, and she's talking about the different customs over there, and she was pregnant, and she had just gone to her doctor in the United States, and they didn't mention anything about. They just said, everything looks fine, baby looks healthy, and then she went to Turkey, and there she said the customs were different, and the women would come and touch you and fondle you and talk about you and like and they instantly were like, oh, what a blessing, you're having twins. And she was like, that's ridiculous, I'm not having twins, I just went to my doctor, I know they would have told me. And sure enough, she had twins. And so a lot of people nowadays are seeing results in their own life. We see people that it seems like they've been to a lot, like my friend and teacher Ming Tong Gu, the wisdom healing qigong grand master Ming Tong Gu. He says, first people tend to find Western medicine, and they just want to get it fixed, some surgery or a drug, or just fix it for me. And then the ones that, when that doesn't work, then they'll try some holistic thing. Maybe they'll go to acupuncture or massage or something. Then maybe they'll go try some diet stuff, and then finally some of them end up going to qigong, because he says he thinks it's because it just takes a lot of work. Like, you got to do some hours of qigong for all that kind of healing. And but there's people that have kind of been through the process, and they're like, that's not like the vehicle they're using to try to get well or to maintain their health or to improve their health over their years. They're just not happy with it, but they don't know totally what to do. They kind of have this idea that, they might have an acupuncturist, a massage therapist. They go to the natural grocer and they get some sort of herbs, and they're doing stuff like that. Where do you see healing going now? I know you and I have talked about the way you're going, and this version that you're creating. You've been creating it for a while, but where do you see it going, and what would you like to see?
Well, I feel that people are getting more aware and more educated, and the divide of traditional medicine and the holistic arts has even become more prevalent as we've been sitting in isolation to see the battle that's going to go on. But the walk and the talk of holistic medicine is a little bit easier to talk to somebody about, and even the prejudice of, like, when we say the evil words of going gluten free, and And General Mills or Duncan Hines or Bisquick are now making gluten-free alternatives. Ooh, there's a force out there that people can't say this is really stupid anymore. And I just I hope people are going to take more responsibility for themselves, and other people are just going to surrender into, okay, I'm going to do what my doctor says. I can have my Diet Coke. I can have, and I just another case study was this woman with RSD, reflex sympathetic dystrophy, and it's been 1 year since she came into the door, and she goes, "Oh my God, I am 3,000% better. I would have been in the hospital 4 times this year in a major procedure that cost over $20,000 to block my nerves, and I had to do that once this year." And she's got her medications, which one of them is oxycodone, which is the terrible one that everyone wants. She is down to 1/10 of what she's taking before on the whole piece of that whole. So she's very proud of being with us. And she would go to the neurologist, she would go to the nurse practitioner, getting ready just to prep into this cycle. And the biggest thing I told her, Ralph, was go on the diet. No gluten, no processed sugars, no almonds, no peanuts. And she's lost 40 pounds, and nobody ever said stop drinking Diet Coke.
Yeah.
As soon as I took that out, she felt 80% better just by taking that. But she was drinking 1 liter a day because she thought she was watching her weight and everything else.
Yeah. It reminds me of someone that came to my clinic years ago and was visiting and got 20 hours of treatment and had a rheumatoid arthritis diagnosis. And we did tell her to go gluten-free, and she had a big shift and a fever that had been with her for months, maybe more, went away, and she no longer has a rheumatoid arthritis doctor or endocrinologist, and she found out she didn't need a lot of the drugs because she had a procedure that needed to be done, this where they had to take her off of all of her meds. And then she realized that she was still out of all of her pain. So she didn't go back. So, but yeah, so that was a bit of, sort of a miracle, but over a week, 20 hours. A lot of people in the integrative manual therapy world, I was one of them, am one of them. Sharon used to talk about she would rather have a therapist that had 100 hours of treatment on themselves and 10 hours of classroom time instead of the reverse. And because once you clear stuff in yourself, you can recognize it more in other people. And because of your healing and transformation, you're a better healer in person. And a lot of people that seem to have come through the integrative manual therapy route and for their own health or their children's health, and then they became students, and then they became practitioners. And it's a thing that they're not going to stop. Why would you stop that? It's a learning thing, and it's a growing thing, and it's a getting weller thing. These days, it's like, it seems like that could be a model for a lot of people. It's like a mastery and mentorship and healing program that you're talking about.
Well, it goes back to that. You get 1,000 extra bonus points. So if you have a sore elbow and you have to hide it half the time from your brain so you can function, that takes energy from the body. So if we can reduce that noise, you will have more healing, more capability of doing that. So the body work is essential. And that's the thing that we've always talked about, is how do you teach touch over the internet? Mm-hmm. How do I show you the experience of this is correct feel, and that's not the sensation that you need to have. So when the student gets the feel, like you said, you went to Julie for the first time and she goes, I think your artery's in spasm. And you're going, I didn't learn that in physical therapy. And that was the first book that Sharon and I wrote, was the Red Book, The Autonomic Nervous System. And
it's a great book.
Right. And so we both
literally under my notepad.
And look how worn it is, right? Oh, yeah. So it is literally, if you never knew the arteries can actually do something like that, why would you even, if you don't know what you don't know, how do you know if you're stupid or not?
That's what Sharon used to say, and that's what you used to you say, and yeah, like it's like if you don't know, will you be able to find it?
Yeah.
Yeah,
So, and you've seen this before, is that we've had children come in and they get treatment, and we say, oh, we're going to do this technique on you and it's going to help your bone heal. And then the kid gets up off the table and he walks by the 5 other people and goes, I see one there, I see one there, I see
yeah.
one there.
I was
So,
talking to a client just another day this week, and about matrix energetics, and gave her a process to be able to use that for herself. She was already soaking in it because she's with me one on one, and so I could tell she was getting it, but she didn't know she was getting it yet. So I gave her a process to do, and I said, but when I show a child, I remember showing this one client's little boy. He was about 8, and I said, here, I'm going to do this, and I just did it for him, and he felt it, and I could tell he felt it. And then I said, just do that to your mom, and then he went over and just did it. So they kind of already know what it,
yeah, and your brain gets in the way a lot of the times. So
yeah,
as we get, and it's actually harder to teach a medical professional
yeah.
that.
And so you teach people whether they've got a bunch of medical training or holistic training or regular training, or moms and dads and people.
Well, we provide that there's too many sick people in the world, and nobody should hold on to information that's so. I sometimes ask a mother to come to a certain class because if I could give her a 3-day classroom in that scenario, and she gets 40% of the information right and not 100%, she could still go and do that to her child and save a lot of time and help her family.
Yeah,
And
I had I've taken 110 of your classes over the years so far, and they were all in books on our clinic in San Diego. And we had a therapist, Kanoi, who had taken a couple of classes, so she knew how to do blueprints and do how to do stuff. And she had a client that had been beat up, was a speech therapist, but had beat up by one of her PTSD kind of clients, like neuroaggressive kid or something. And so she took the autism book and did the blueprints on speech. And she said she wished she could have like recorded because the person could talk much better. And so she didn't have the training in that class, but she knew the principles of it. So one of the things that's cool about IMT is if you have one of the classes, then you know some of the principles of like, oh, here's how to do these blueprints, and here's how to do a template,
yeah,
and here's how to do a compression syndrome, and here's how to fix up a
yeah,
disruption of membrane, and then you can just like roll with it. It's like,
yeah. And that's part of the training now, Alf. You know, we when you started with us, we were very oriented to the medical model, and we were fearful, and life has changed a lot since that time. Medicine, you and I were trained that you had to do A, B, and C in medicine. You had to learn your bones first, then you can learn your muscles, and then you can go to the next step. So that model really was the background of how we started training people in the past. And now I teach them, I don't even give them, I just say, do it this way, see the change. Okay, now let me teach you the anatomy behind it. And
wow,
so,
that's wonderful.
yeah,
That takes
so,
the head out of it a bit, and
yeah.
they can just go do it.
So I had a mom come in with a son who's 12 years old, and I taught her the 3 techniques. And I said, this one's myofascial release, this one's a disruption of membrane, this one's a bone bruise. Okay,
Wow.
come back tomorrow. You're going to do them on my leg. Perfect. And she has no problem going on her son's shoulder and say, I think that's a disruption of membrane. And I'll say, you're correct or not. And she does it. And yeah, and remember how long it took us to teach that to everybody.
Yeah, bone bruise. We had numerous classes before we weren't even allowed to take that class.
Yeah. So yeah, it's an amazing concept that there's probably maybe 100 different types of therapies, and they're not very different from each other. They're all stemming off of, after you learn myofascial release, 3-planar fulcrum technique from us with an indirect piece, you could probably do 80% of the therapies and just put your hands.
And it's incredible because that's it's so much simpler and easier to use and learn than structural integration, rolfing, massage, like all these technique based things. It's like it's one of the easiest things you can do.
Yeah. And it's just then thinking, how do you use it and how do you apply it? It's just a wonderful thing. So I think we
Yeah.
have some really good miracles out there on doing that whole piece. And, you know, I hear those every day. You know, just took somebody off of gluten and their arthritis went away. That's another miracle that happens. So
Yeah.
if you have anybody that suffers from the diagnosis of rheumatoid arthritis, get off of gluten and oats for 6 months. And I've had successes up to like 85%, but I'm usually saying about 45% of people will change if they're hyper vigilant about not putting those things in their diet and
I
willing
found
to
the
give it
same
up.
thing. It's like 100% gluten free, big miracles. That's a
Yeah.
free gift from Dr. Tom today. If you go with it, that is like beyond what you could imagine just doing that one thing. But
Yeah.
yes,
And that's wheat and oats.
yeah, oats included, even
Is
free oats.
Yeah. And so, I mean, if you have a new car 2020 and you know you drive your 4,000 miles and the engine's pinging because you change the oil and it goes back to normal again, and you have a car from 1970 and an oil change isn't going to be the miraculous thing that it is in the other one. So, you know, people who've been sick and ill and in a model of going, okay, I mean, if you buy every month a bottle of Tylenol or a bottle of Claritin or any other, if you have an account at CVS and you get those coupons every month, I would say that you're just surviving and you're numbing yourself up. I mean, I haven't taken an aspirin in 20 years, probably, right? I
Yeah,
don't have.
and one of the things, so it's like it's a choice. You know, of course, people can stay in that model, and then people that are looking for, you know, for is there a way to help your body in a more natural way? Can you really shift these things and be different, be well? Um, um, you have something that you do every so often, and I haven't been sharing it enough. I need to make sure Jen sends it to me every time. But you have online stuff where people can start to interact with you. What is the best way just to get on your email list, like info@imtwellnesscenter.com, or
Yeah,
mail those
that,
out?
yeah.
Okay.
And you can ask questions there at imtwellnesscenter.com. And if you have any personal questions on your own health and well-being, I do a 15-minute consultation and I try to help you find somebody in your area because we have students all over the country or
Even all over the world.
all over the world too, right? So we see if the person's really interested. Sometimes I give them personalized homework and say, call me back next week and tell me if you're any better or not. If you are, good. If you're not, okay. So I try to start people off, or I'll say, okay, why don't you just stop white sugar this time and see if you could do that. And if people can't, they're you know, they're trapped in a process that this is not sometimes not the fastest, but I definitely feel, and I hope you agree with me, that it's one of the most correct reversal to well-being that you could have.
Yeah, and you know, that very first treatment I got, I solved the running thing. I was back to running after 8 months, so that was a miracle, instant miracle. But my anxiety definitely came down during that session. It didn't go away completely, like I still had my triggers and stuff. But over the course of treatment, we got to that, the causes
Yeah.
of that, and cleared that, and also cleared the things that were in the way, causing all those cavities for all those years. So yeah, so it's kind of a mastery thing, I think, and a mentorship thing, and a student learning thing, and how to be your own, like you said, inner physician.
Right.
A time or two ago, Dr. Upledger.
It's a lifestyle change.
The lifestyle change, yeah. Yeah, so imtwellnesscenter.com, and you can go to info@imtwellnesscenter.com, send an email, and Tom does these online things. But like you said, it's hard to teach how to do this, but it's not that hard to learn if you just get some instruction. And part of the instruction is getting yourself well, I feel. and experiencing it in your own body. So there's people all over the world that are doing this, and so reach out to me and Tom, and let us know in the comments where you're from, or email me, Ralph@ralphhavens.com. And I have one more thing, just to kind of like have people check in on when you think of like an instant miracle, when you think of how fast can something change. What you might want to do is to walk around the room after this time where me and Tom, where we're just seem to be just hanging out, and check how your neck feels, and how your back feels, and how your feet feel, and how your walking feels, and how your outlook on life feels, and how the world looks, and just notice what you notice, and if notice what might be different, and because what you are doing is soaking in something right now. There's an energetic thing that's here, and if you're interested in more of that, let us know, comment below. And I am doing my next group one this next Sunday. I do a once a month healing session, and you can have the first one free. So that's ralphhavens.com/free miracle session, free session for an hour. So look for that. Email Tom, info@imtwellnesscenter.com, and let him know where you're from, or just comment below. Let us know some way, and we can hook you up with somebody that can show you some of these techniques and start you on the path. Because what Tom and I are up to, one of the things is to bring this to the world in a bigger way again, because there's a lot of people that have, you can learn how to do these things for yourself, and you can also have somebody like Tom or I helping you out, and doing things for you. But in the process, it's a lifestyle, like he says, Tom says, a transformation, a way of living that's different, and I feel it's just so empowering. So I want to help everybody know that you can connect with Tom, you can connect with me, and we're going to keep doing these as long as we keep doing them. Anything else you want to say?
Nope, I think happy Memorial Day is this weekend, I gather. And hopefully we'll get back to a different status. And I've been enjoying the time with you. And I hope the world continues to heal for the better.
Awesome. And so since it's Jen's from Indianapolis, and the Indy 500 is this next weekend, I'll say, gentlemen and gentlewomen, start your engines.
All right. I'll have a good week.
Bye now. Bye, you guys. So yeah, reach out to Tom, imtwellnesscenter.com. Reach out to me, ralphhavens.com/free miracle session. And if you want to join us this Sunday for a free session, just grab that link. All right, you guys. See you very soon.